So sticking with the theme of technology and the way that can be used to really enhance measurement, one of the things I've been interested in is the use of consumer devices such as an iPad to replicate some of the tests that we do in the clinic. So for instance, there was recently a study shared in the Journal of Visualized Experiments, which gives videos instead of papers, about a modification of the MS functional composite test, the MSFC, where the pegboard was done on an iPad, the PACEAT, the auditory pacing task, was done through the device, and actually you could even strap the device to someone's back and have them walk, and rather than it just be the subjective impression of a clinician, it's the objective data that came from the accelerometers. And what that potentially means is that patients could test themselves with the help of a caregiver, and that we could have more consistent data, rather than us all having to agree on what's a 3 and what's a 4 on some rating scale. The data will be there in physics, not in human perception that's converged upon. Another area that I was very interested in was the use of a video game camera. So a lot of newer consoles come with cameras that have 3D tracking capabilities, sometimes even thermal imaging capabilities. And in a pilot study in Switzerland, about 100 patients and about 80 controls had been asked to do a series of movement tasks for fine motor coordination. And again, by actually taking telemetry data from the infrared cameras, we're going to have a much more reliable picture. And one could imagine that that could be the data fabric that underlies a remote management system. In the same way that Halo or Uber can manage a fleet of taxis remotely through GPS, GPS for multiple sclerosis patients would allow them to have a better understanding of where their trajectory is going, and perhaps even the effects that their treatments are having. Perhaps with a better understanding of that, we'd have increased compliance, and we might be able to focus in our clinical consultations on the issues that matter to patients, sometimes the ones they haven't even noticed that have changed, or that we haven't been able to notice in the time since we've seen them outside the clinic. The best thing about these devices is, they only cost a few bucks, as opposed to a highly trained neurologist, of which there are not very many. So I think that really the potential is there. And again, it's really up to us to pursue this and to think of the ways in which we can validate these tools and perhaps one day integrate them into our practice. Where we are today is of the hundreds of thousands of people with multiple sclerosis, only a tiny fraction of them have their disease journey quantified. When people are in a clinical trial for 12 months or 18 months, they're measured very carefully. When a small number of people are at a tertiary specialist referral centres that has a longitudinal observational registry, again, but it's a rounding error, it's 0.1% or something of the total population. The revolution that's happened in the consumer world is big data, and that means taking every data point at every transaction. Walmart knows everything you buy, and that's how they make buying decisions. They don't just track a sample of 0.1%. So shouldn't we at least have the same decision-making technologies that Walmart or Facebook or Google have? So the idea of technology is to support the learning healthcare system. If we can make these sensors ubiquitous and passive and extremely cheap and distributed, then that means that every patient will be a data point, a continuous data point. And the goal of the learning healthcare system is that every patient who comes in the door, the decisions about their treatment will be made using the data of everybody who's been walking in their shoes as recently as the patient that was in before them, and that conversely, their data will inform the treatment of the next patient that comes in through the door and everybody like them. That's a far more democratic approach to research and to data, and ultimately that's the only way we're really going to tackle these challenges at scale. It's just whether or not we can get over our habits of collecting our siloed data sets that we own, as opposed to saying, no, we're going to have a collaboration with patients, and with their permission, they will allow us insights into how they live their lives. At the moment, the first step for us with any new technology is validation. No one's going to take you seriously about the fact you've got 10,000 patients doing this or that or whatever until you've given some degree of confidence that you've done your homework, you've mapped it back to existing standards. I'm not a particular fan of things like the EDSS for various reasons, but I think it's a common vocabulary that people have, and so it's important to lay that base layer of credibility. With that in place, you then go and replicate known findings, so we can go and see if we see what other people in the literature have found. If you're finding consistent results there, then you can start discovering the unknown unknowns, but it is all building up to a pyramid of credibility. So, what we're trying to do right now is working on data with wearable devices, things like Fitbits. We've recently completed a pilot where we had 100 patients with MS wearing Fitbits for a month, and we're starting to map out the different ways in which step count can correlate with patient-reported outcomes of walking, for instance. And it'll be interesting to see, is this useful data? What surprises does it throw up? We'll want to see, do we see that people who've got a 20-year history are having a different walking pattern than someone who's got a 2-year history of disease, starting with the known knowns, and then that allows us to build up that level of evidence. I think what is compelling is how much quicker you can do that with a digital platform than in the clinic, where we can only see, a few people in person, face-to-face per day. We also don't want to throw the baby out with the bathwater. It's very important that we build trust and relationships face-to-face, but in between those touch points, I think technology can fill in a lot of the gaps in the data, and potentially even in the way that we prioritize who it is that we bring back into the clinic and see face-to-face.